to the classes of antibiotics that target protein synthesis. So remember, prokaryotic ribosomes are unique. They have a different structure. There's two subunits, the 30 and 50S. Now, they still have the same end goal. They make proteins. They synthesize proteins. So the easiest way to prevent the cell from making proteins, which are essential or necessary for life, is to inhibit some aspect of the ribosome. So the aminoglycosides, tetracyclines, macrolides, and the chloramphenicals are 4 classes of antibiotics that all target some aspect of protein synthesis. So the aminoglycosides, they cause misreading of messenger RNA. They'll bind to the 30S subunit on the ribosome. They're actually not effective against anaerobic organisms, enterococci, or even streptococci because they just don't have appropriate transport mechanisms. And they can come with nephrotoxicity. So nephrotoxicity, that's toxicity of the nephrons, which is the functional unit of the kidneys. So it can cause kidney damage. So they're typically not prescribed a ton, used when absolutely necessary internally, but they are very common used externally. So like neomycin, that's an example of aminoglycoside. That's the second antibiotic in the triple antibiotic ointment, or neosporin. So you would see neomycin, but we also have gentamicin and streptomycin. They can be prescribed orally or intravenously for infections, just not as common. The tetracyclines, they'll prevent attachment of transfer RNA, so they will bind to the 30S subunit and prevent the TRA from creating the elongating chain of proteins. They are effective against both gram-positive and gram-negative. There's newer tetracyclines like doxycycline you may have taken before, and that will have a longer half-life, which is going to allow for less frequent dosing. Now, we do know that tetracyclines aren't given to children because it can cause discoloration of the teeth. So we don't prescribe tetracyclines to children under the age of 6. It can bind to the calcium ions in the teeth and cause them to form a yellowish or brownish color. So if you look at the picture and you see the line or that band across the teeth, that's usually indicative of a child who has had tetracycline. They are very commonly used to treat skin infections. So typically, a lot of skin infections, physicians will prescribe the tetracyclines. The macrolides, they will bind to the 50S subunit and prevent continuation of the protein synthesis. They are effective against a lot of gram-positive organisms. They're the most prescribed antimicrobials for walking pneumonia or atypical pneumonia, which is a really mild form of pneumonia. It's caused by Mycoplasma pneumoniae. We do give a lot of macrolides to patients who are allergic to penicillin. So anytime I get an antibiotics, it's going to be one of the macrolides. Erythromycin is very common, clarithromycin, azithromycin. So if you've ever taken a Z-Pak, that's azithromycin, that's a macrolide. Chloramphenicals, they will block peptide bonds. So they'll bind to the 50S subunit and then block protein synthesis. They are broad spectrum, so they can be used against a wide variety of microbes. And typically, they're only used in life-threatening situations because they can cause aplastic anemia. So not used routinely, but they are potent and powerful should we have a patient who needs that type of antimicrobial. All right, in addition to protein synthesis, another way that we can inhibit the growth of bacteria is to prevent nucleic acid synthesis. Nucleic acid, that's the RNA and DNA of the cell, very important for the cell to function. So fluoroquinolines are a class of antibiotics that will prevent supercoiling of DNA. So in our cells, we have different, what we call this is a hard one, topoisomerases, which will conduct the supercoiling or winding or packaging of the DNA into its chromosome. So we can target specifically the supercoiling aspect because they use different topoisomerases. Ciprofloxacin and moxifloxacin are two examples of fluoroquinolones. Rifamycins, like rifampin, they will actually block transcription. So RNA polymerase can't transcribe messenger RNA from DNA, and so downstream translation would never happen, and then proteins would never be made because RNA, is an important bridge between the DNA and the proteins. These are typically used to treat Neisseria meningitis infections, as well as Mycobacterium tuberculosis, which causes TB. There are also classes of drugs that inhibit metabolic pathways. We've talked about this a little bit. Sulfa drugs will outcompete PABA for a enzyme number 1. You can see in this pathway. So bacteria make folic acid or folate. It's an ability that we don't have. We have to get it from our diet. So by preventing the bacteria from making their folic acid, they die. They need it. It's essential for their survival. Trimethoprim is another class of antibiotics that will inhibit a different enzyme in the same pathway. So it's still using competitive inhibition here, just it's not outcompeting PABA, it's a different molecule. So if you've ever taken Bactrim before, that's a combination of a sulfa drug and trimethoprim. Typically, they're prescribed synergistically. They're used together at the same time. And in synergism, it's where two drugs work together to create an effect that neither one can do apart. So we actually get an even stronger killing power when we have two together than if we were just to measure the killing power of each one individually and add it together. So it's creating an effect really that neither one can on their own. So sulfonamides, they can inhibit growth of both gram-positive and gram-negative organisms through competitive inhibition. And we said that, humans don't have this biochemical pathway, so it doesn't affect us. Trimethoprim, same thing, just going to inhibit a different enzyme in the pathway. We also have some antibiotics that are going to inhibit the cell membrane. We don't have a ton of these. And that should be obvious because both eukaryotic and prokaryotic cells do have cell membranes. And it's a phospholipid bilayer. The structure is relatively the same between the two cell types. But we do know that eukaryotic cells have like sterols embedded in the membrane and prokaryotes don't. Polymyxin B is the most common. It's used in skin ointment, so that's the third ingredient in our triple antibiotic ointment. You'll see polymyxin B. It will bind to the outer membrane of gram-negative cells, but remember, gram-positive cells have a thick layer of peptidoglycan protecting their cell membrane, so it doesn't do a whole lot of damage to gram-positives. And then because we have a cell membrane, we don't take polymyxin B internally. It's used topically because the outermost layers of our cells are dead, so we don't care anyway. So those are the different type of classes of antibiotics. In the next video, we're going to begin to talk about susceptibility, and we'll learn the different ways that the microbe can become resistant to the drug and how we combat that in a healthcare setting.